Psychological Disorder Project, Anorexia Nervosa by Jacob McKinley. Definition of anorexia nervosa: an eating disorder primarily affecting adolescent girls and young women characterized by a pathological fear of becoming fat, distorted body image, and excessive dieting. Symptoms and characteristics of anorexia nervosa: low body weight, distorted view of one's body weight, size, or shape, sees self as too fat, even when very underweight, expresses feeling fat even when very thin, excessive physical activity, refuses to maintain minimum normal body weight, preoccupation with food preparation, bizarre eating behaviors, denies feelings of hunger. Treatment methods of anorexia nervosa. There are a number of treatments used for anorexia nervosa. A treatment plan is developed to address the specific needs of the individual. It usually includes treating any serious medical problems first, and then focusing on weight gain and addressing the psychological issues that have led to the development and maintenance of the anorexia nervosa. The gaining weight is a key part of any treatment plan, since improvements in mood, personality, and interpersonal relationships cannot be sustained without it. Treatment methods of anorexia nervosa. The types of treatments that may be used for anorexia nervosa include psychotherapy, individual psychotherapy, family therapy, marital therapy, group therapy, support groups, medication, and hospitalization. Psychotherapy, individual psychotherapy. Individual therapy provides a safe place to learn how to identify concerns, solve problems, overcome fears, and test new skills. There are many types of individual therapy. Cognitive behavioral approaches can help to develop healthy ways of thinking and patterns of behavior, particularly with food and relationships. Psychotherapy, family therapy. Family therapy is almost always used as part of treatment when the person with anorexia nervosa is young or living at home. Family therapy can be used to provide information about anorexia nervosa, assesses the impact of the disorder on the family, help members overcome guilt, improve communication and decision-making skills, develop strategies for coping, and develop practical strategies for overcoming the disorder. Psychotherapy, marital therapy. The primary goal of marital therapy is to strengthen the relationship. It can provide practical suggestions on how to deal with the disorder. It may also help identify and resolve communication problems. Psychotherapy, group therapy. There are many types of groups, each with different goals and orientations. Some groups are task-oriented and may focus on food, eating, body image, interpersonal skills, and vocational training. Other groups are aimed at understanding the psychological factors that may have led to the development and maintenance of the disorder. Groups can assist in dealing with other associated emotional symptoms such as anxiety, depression, and anger. Sharing experiences with others in a group can be very effective in helping reduce guilt, shame, and isolation, and can lead to important insights regarding strategies for recovery. Support groups. Support groups can provide people with anorexia nervosa and their families with mutual support and advice about how to cope with the disorder. They can also prepare someone for therapy who is afraid of it. Medication. It is generally agreed that medication alone is not effective. Because depression and other emotional problems are often a result of starvation, it is best to focus on weight gain rather than medication. However, occasionally, medication may be required to deal with overwhelming anxiety, obsessions, depression, and gastric discomfort following meals. Hospitalization. One of the advantages of hospital treatment is that it provides a safe environment where food and weight can be carefully monitored while psychological concerns are explored. While in the hospital, a variety of treatments may be used, such as family meetings, individual therapy, group therapy, occupational therapy, and occasional medication. Conclusion. Anorexia nervosa is the third most common eating disorder that anyone can get, and it can be fatal. But with treatment and dedication, you can overcome this disorder and return to the life you had before you got anorexia nervosa.